Hi, I'm Kim Kennedy, and I'm here with my husband Burton, and I'm doing the first student assessment video on the skin, eyes, ears, nose, mouth, and neck area. Okay, so I'm going to begin with an assessment of the skin. The skin is pink. Um, he has normal male pattern hair to the arms and legs. I need you to take your socks off. And I'll begin with the skin turgor on his hands. It's good elasticity. And feet, good elasticity. And the fingernails are clean, short. It's good capillary refill, less than 3 seconds. And on the toes as well. We do have a small toe the nail itself is a little bit thicker than the others. Capillary refill there is good also. No edema. No varicosities noted. To the face, the head, we have a couple small little macules. We have a papule here. The hair on the scalp is thick and it is somewhat coarse. Scalp is freely movable. Now we'll look at the eyes. We'll do a few eye tests. And I'm going to do them with his glasses on because otherwise you can't see anything. So, okay, look at my light. Look out there. Okay. And then I'm going to shine. If I stand around about here, I can actually see the red reflex. All right. And that's good. Okay, and the Snellen test would have already been done, and Rosenbaum, the Snellen test tests for distant vision, and the Rosenbaum test for reading. Now I'll do, look at my light here, and cover one eye. And now look to your left, and now uncover that eye. And they both track equally. And pupils, constrict equally. Pupils are round, reactive to light, and they both accommodate. Let's see. Now, the 3 tests I just completed tested the optic nerve, which is cranial nerve number 2. And now we're going to move on to the ears. And the auricle of the ear is flexible. I don't see any lesions around the ear, nothing around the mastoid area. And I would use an Otis ophthalmoscope to look into the ear. And the cone of light is at 5 o'clock in the right ear, it's in 7 o'clock in the left ear. And the tympanic membrane is a pearly gray color. There is a slight amount of earwax, small orange color, or light orange color rather. But I don't see any cupping or tears or bulging of the eardrum, and I don't see any fluid behind the eardrum. Now we'll do a test to test the hearing. It's called the whisper test, so I'll get you to cover that ear. And now I'm going to whisper something, and I'll have you repeat it back to me. Okay, what did I say? Right. And then I'll do a couple other tests with a tuning fork. And I'm going to put this on the top of your head, and you tell me where you hear it. In both ears equally, or one versus the other?
Equally.
Equal. Okay, good. And the next test I'll do is going to test bone conduction versus air conduction. So I'm going to put it right behind your ear, like here. And you tell me when you don't hear it. Do you still hear it? Okay, tell me when you don't hear it. Air conduction is typically greater than bone conduction by a ratio of 2 to 1. Okay, I'm going to go back and to the eyes. I missed the talking about what to see when you look inside. And because I'm in Finland and my otoscope, my ophthalmoscope won't plug in, I'm going to just describe what I would see. When you look into the eye, you're going to look for the fundus, the macula, and their inner structures, the vascularities, the optic disc. So those are all the things that you would actually see. The sclera, talk about the sclera again. The sclera is white. I do see some vascularization. No exudate. The lacrimal ducts are within normal limits. And we'll talk about the eyebrows also. The eyebrows are symmetrical. They begin as normally. They are somewhat thin, groomed, thank goodness. Now we'll move on to the nose. And with the nose, I can see that the septum is midline, mucosa is moist. I can see one set of turbinates. And now we'll test the nose. Go ahead and block one there and breathe. Okay, I'll do the other one. Okay, and now we're going to test cranial nerve number 1, olfactory. So I want you to close your eyes and block off one nostril. And I'm going to give you something to smell and see if you can identify the smell.
So.
All right. And now I'll get you to include the other nostril. And I'll see if you can identify this smell.
Vinegar.
Yes, vinegar. And next we'll be looking at the mouth. All right, open your mouth for me. And the teeth are white. There are (26) teeth, and the wisdom teeth have been removed. The mucosal lining is pink. I don't see any lesions, no ulcerations. Gums are intact. They're not receding. The superior frenulum is intact. Raise your tongue up. And the sublingual frenulum is intact, as well as the inferior. Of course, if this were another patient besides my husband, I would have gloves on. Hold your tongue up. I do see Wharton's ducts are palpable. Hold your tongue up for me. No, down. And the tongue is pink, smooth, has a few ridges. Say ah. Open that wider and say ah. Okay, and I can see the tonsils. The uvula is midline. And the tongue is actually innervated by cranial nerve number 12, which is the hypoglossal, and the act of swallowing, speaking, gag reflex, movement of the tongue up and down are innervated by cranial nerves number 9 and 10, the glossopharyngeal, and number 10, the vagus. Let's see, where next? I guess we'll go to the throat, neck area. I would check for palpable lymph nodes, periauricular in front of the ears, in the mastoid area, down into the neck, and then those into the cervical chain and the supraclavicular area. And most lymph nodes should not be palpable. And then we're going to check the movement of the neck, which is cranial nerve number 11, which is the cervical. All right, and go back and forth. And push against my hand. Okay, this one. Okay, and do the shoulder shrug. Shrug your shoulders, and now put them down. And now to resistance. Okay, and again, that's testing cranial nerve number 11, cervical. I would also, when I was doing the face, I would check the TMJ joint, right, and move your jaw in and out, jet it forward, backwards. And that's testing cranial nerve number 5, which is the trigeminal. And then when we were doing the oculomotor test, having him gaze back and forth, we'll try this one. So here, go out, and just follow it. And these tests are looking to test the cranial nerves number 3, 4, and 6, which are oculomotor, trochlear, and abducens, which checks the actual extraocular motor activity. Let me see. I think that's about it. I'm trying to think of another. And check the olfactory acoustic. With the whisper test was the acoustic. So I think that just about covers it. Thank you. Oh, one more thing I forgot. To pan the room with the camera, and I'm going to try to do this so you can see. We're in an upstairs bedroom of my daughter's. And back.